So before we get started on PPE and cleaning, you may have seen my previous video which was all about screening. So this is just to start talking about some of the issues in a little bit more detail. So in terms of PPE, clothing is still part of personal protective equipment, ultimately because you can carry and transmit COVID via your clothing, and this is because potentially there might be droplets or other things. So ultimately the general advice is that clothing where you think they could be contaminated should be washed at a hot wash of 60 degrees. Now, for most people, we are screening them at the door. Once they come in, that's fine. A normal wash is probably very reasonable. The hotter the wash, the better. However, if you're the screener, then you are coming into contact with more people. You're coming into contact before you decide whether they're going home or not. So I would definitely recommend you wear something that's thick and cottony that can be washed on a very hot wash, or can be wiped down as well. So up to you, have a think about what that could be. So the reason why in the hospital, for example, we wear scrubs is only just because it can be washed on a hot wash. There is no other reason or requirement to wear scrubs. In terms of PPE, we talked about 3 levels, of which the 3rd level was mainly for healthcare professionals, but level 1 being the actual surgical mask, level 2 being all the bits that are shown here as well. So I would expect someone who's doing the screening to wear level 2 PPE at all times. I would expect someone such as a coach or a player to be in level 1 PPE, but remember we said that because it's a non-clinical setting, apart from the screening team, everyone else could wear 3-layer cloth-based face coverings, which is better for the environment, reusable, and gives it not far off the same level of protection as a surgical mask anyway. In terms of PPE, here you can see it again, so remember there is the level 1 surgical mask. Level 2, you've got to have covering for your eyes, because remember you can transmit COVID through mucous membranes such as your eyes. So you need to make sure your eyes are protected against droplets, and again the same with your face covering or surgical mask as well. You need an apron, and then you need gloves. So a true level 2 and level 1 is a surgical mask, but again remember we have talked about a 3-layer mask, cloth covering being appropriate, except for the screening members of the team who should ideally be in a surgical mask. And I would advocate on top of goggles to wear a full screen visor. That gives you a full level of protection and security that I think is worth it when you're coming into contact with lots of people in one way or another. Remember, level 3 is for healthcare professionals, potentially who might be doing CPR or other things. It might be worth keeping some PPE that's level 3 standard if your healthcare professional is trained appropriately, that they keep with their emergency kit. But again, that's not a requirement. And again, if you look out at the CPR resus video that I'm doing as well, you'll be able to see our discussions around that. So PPE, we've talked about the face shield, really cheap. You can wipe them down and reuse them, so it's worth considering, but obviously they don't last that long. I would advocate that if someone buys a face shield, that they keep the face shield that they were given. You can wipe it down, put it back in a bag and reuse it. In terms of face masks, remember face masks can be surgical masks, which are this one here. So surgical mask is made up of 3 layers. This is a blue layer, which is fluid repellent, and then the other 2 layers are absorbative. So the blue layer should always be on the outside, okay? And I'll talk you through how to use it. This is a surgical mask. So you can see here that there's a blue layer, there's a white layer on the inside that's absorbent, and there's a layer in between. Now the loops on the outside are the things that you should really be holding on to most of the time, but remember at the start it's fine. So this is a clean mask and no one's touched it, there's nothing on it at the moment. I'm going to sanitize my hands or wash my hands first, then I'm going to grab the mask and I'm going to make sure it covers above my nose, because I want to cover nose and mouth, not just mouth. Okay, once it's done, remember there's a metal bit on the top here, or a wiry bit, so that can be used to get comfort and a fit around, and then I need to pull the mask around. So I'll just show you that now. Okay, so this is a clean mask, I've sanitized first, I'm going to pop it on, put the loops around, so you can see it's now covering my nose as well. I'm now going to bend over that bit there. So that's over my nose now, so that's done. And then I'm just going to pull that round as well. So now you can see that that wiry bit has been bent over my nose. You can see that it's got a reasonable seal around it, and it's got good coverage around my nose and mouth and all the way down. And at that point now, in that position, it will stay on for ages. So I can do a whole healthcare shift, and I will be usually wearing this for maybe anything between 8 hours plus, and there's no such issues with it on. So it won't make you breathless. It's just about getting used to the mask, and you can talk quite comfortably through it as well. Okay, taking it on or off after I've used it. Remember, there's going to be potentially droplets and other things on the mask, so this is the worst area. If you do touch it or you try and readjust your mask, you need to re-sanitize your hands immediately. Otherwise, you should be taking on and off your mask by holding onto the loops. So they're your non-contaminated areas on the whole. And if you're going to place it down the surface, place it down like that, because remember the outside is fluid repellent, and then you can pop it back on if you need to. Okay. So I'm going to leave that there, and then if you are using a 3-layer cloth covering, then they're exactly the same. You got a loop. If it's clean, you're going to sanitize your hands first, pop it on. You're going to press over the core bit onto your nose and then pull it right round so you got full coverage, and then it's on again. Now once you've started using it, you need to make sure that you take it off by the loops. If you're taking it off, remember, if you touch the front of the mask, you need to sanitize your hands straight away. Now the interesting thing about these is while the disposable surgical masks you're just chucking away, these are washable. So I have like a Ziploc bag, so basically like a plastic sandwich bag. What I generally do is when I've finished, I fold it in half on the coil area and I pop it into my sandwich bag, and then I'll sanitize my hands. And then when I take that home, I'll then chuck that in a washing machine. But it means that I can reuse it on and off. If I put it back into the cloth bags and put it in my pocket, when I take it out of the sandwich bag, as long as I'm not touching the outside, I can put it back on again. Again, if you did contaminate your hands on the front, it's not an issue, just sanitize them again. So keeping hold of alcohol gel is critically important. So again, I would advise, and again, it's only optional, it's not mandatory, but I would advise that you tell your players and your staff members to have their own personal supply of alcohol gel, separate to yourself. Okay, so donning and doffing. So again, you will see this and you'll get the slides as well. But how we take on and off our personal protective equipment is incredibly important. So ultimately, when we are putting on our protective equipment, the first thing we need to do is we need to wash our hands. Preferably soap and water is better, but if not, hand sanitize. Then you're going to put your apron on, so your plastic apron on first. Okay, once you've done that, you can then put on your face mask as we've done just now. Bend over the metal strap so it's over your nose, pull it round and make sure it's comfortably on. Once that's done, you can put your eye protection, so goggles or a face visor on. And then finally, the last thing to go on is the gloves. Okay, so likewise, when you're taking it off, it's pretty important you take it off the same way. So take off your gloves first. Once you've taken off your gloves, you can then take off the rest in turn. So again, remove your gloves, clean your hands first as sanitize or wash, then take off your apron, then take off your eye protection, and then clean your hands again. Okay, if you're not sure, you think you've touched something you shouldn't have touched and you're going to touch something else, clean your hands again. So donning and doffing is what it's called. So donning, putting on, doffing, taking off. That's the current terminology. In terms of cleaning, well, anything where the player, the team member, comes into contact with a surface needs to be cleaned regularly. Ultimately, from my point of view, any time you see someone, a member of your team, whether they've symptoms or not, whether they've been screened and they're clear, it doesn't matter. Treat everyone as though they're COVID till proven otherwise. That will always help you to some extent to manage things. So if anyone touches the surface, think about whether it should be cleaned. So my advice to you as a club or an organisation would be to walk through your leisure facility and consider all the handles, doors, touch points. So for me, in a basketball setting, that's going to be, as I walk through, the doors that I touch. If I go to the toilet, the doors and the handles that I touch. who's cleaning those down? Ultimately, ideally, after someone's washed their hands, they should wipe down, for example, the toilet handle and the door as well, if possible. Coming through then into the actual gym itself, are there benches there? Are they touching that? Who's doing the scoreboard? Has that been cleaned before and after they touch it? Are there any pens or other things in use? The balls would be another one, cones. Anything people come into contact with needs to be cleaned regularly. And you can see from our guidelines, every 20 minutes we'll recommend you cleaning the balls. And remember, if you're using Clinell wipes, they take 20 seconds to dry, so make sure you've had time to dry. Regular cleaning is a good thing, and at the same time as a cleaning, if there's a break, that should be a good time to sanitize our hands as well. In terms of cleaning products, there's tons of stuff out there and lots of options. We use a company called Fit for Sport, and we would recommend you use them. They're very good. They've got reasonable stock. And in terms of wipes, there's two main companies. There's Clinell that they supply, which is probably the most well-known company. Sanicloth is an alternative as well, and they both do something called the universal wipe, which would cover COVID, but do check again with the packaging. In terms of spray, there's Duramax and there's Clinell. Again, Fit for Sport will also supply these. And in terms of hand sanitizer, again, Fit for Sport and a range of other places supply hand sanitizer. I would get kind of large tubs that you can squeeze down, and ideally I would encourage you to tell your members and your players to bring their own as well with them, so they have their own personal supply. So that's it from a point of view of PPE and cleaning. We will send you a list with links to Fit for Sport and where you can buy some of these products to try and help you. Of course, if any changes occur or any developments occur, we'll try and keep these up to date. Likewise, do share your experiences of what's working for you on the ground and what isn't.